After 21 years of living in Las Vegas, an undocumented man is now leaving the country, but not because of deportation, but because doctors say they can no longer treat him.
Now he's returning to Guatemala, though he knows his cancer has returned. Fox's Carla Salinas has the story.
Lazaro Serrano has spent the last 2 decades working and building a life in the United States until one day everything changed. Serrano underwent surgery to remove a cancerous tumor and spent roughly 2 weeks in the hospital. But just 3 months after being released, doctors gave him devastating news. The cancer had returned.
They
told me I could no longer stay at the hospital because I don't have insurance, and they escorted me out. Without legal status, Serrano says he was denied continued treatment.
Como 20 años aquí.
Since I don't have papers, they took me out of the hospital, and even though I've worked here for 20 years, I've never committed a crime and my record is clean. Under the Emergency Medical Treatment and Labor Act, federal law requires hospitals to provide emergency care to anyone regardless of legal status, but that law only guarantees emergency treatment, not long-term care. When it comes to undocumented people who are in need of medical care, is there anything that they can do? They obviously don't qualify for insurance here in Nevada. So what can they do?
It's really difficult. They have a very narrow window for services, and that really applies to emergency life-saving care, unfortunately. So if you've got specialty care needs or a very serious or complex diagnosis, you're really back at zero as far as access to health care.
We reached out to both UMC Hospital and the Sunrise Health System, who represent Southern Hills and Sunrise Hospitals. Both say they're in accordance with the Emergency Medical Treatment and Labor Act. UMC Hospital did add, once a patient is stabilized and eligible for discharge, it's their responsibility to complete follow-up care. When it comes to minor diagnoses, there are a variety of low-cost clinics across the valley. This list provided by the Southern Nevada Health District outlines several clinics that work with uninsured patients, but when it comes to something like a cancer diagnosis, undocumented people don't have many options.
The nonprofit Reach also has a variety of resources available to people who are uninsured who are looking to connect with a low-cost clinic. We will have more information on our website. That's fox5vegas.com.